So we use what we call the United to Thrive framework, and that focuses on the 5 elements of a thriving community. So it's economic opportunity, early childhood success, education success, essential needs, and health and well-being. So those kind of help guide us in our work to create thriving communities. We look at all of the elements that go into each one of those 5 elements in order to kind of decide where we're going to direct our energy.
Yeah, and then what about the 5210 initiative? I know I've seen a lot about that online on your site. How did that start and how did it come to Iowa and kind of what is that like?
Yeah, so the 5210 Healthy Choices Count is a nationally recognized prevention-based framework to promote healthy habits. And it originally came to Iowa in March of 2016 when the Central Iowa Healthy Kids Coalition wanted to create some messaging around healthy lifestyles that was really kind of snackable. So it's the 5 fruits or vegetables a day, 2 hours or less of screen time, 1 hour more of physical activity, and 0 sugary drinks. So it's a really easy kind of framework to promote for physicians' offices to use and schools and childcare centers. So we started with that messaging and spread it statewide with a number of our other partners as well. And it really started with kind of looking at that messaging that impacts individual behavior, but it's moved to more of like looking at the environments and systems that can help create healthy communities.
And then you want to tell me a little bit about that, I guess like the environment and systems, I guess research or what you're kind of messaging on?
Yeah, sure. So as I'm sure you're aware, childhood obesity is super complex. So it's about so much more than just eating healthy foods and moving and being more active. We're looking at where do children live, work, and play? Do they have access to green space? Do they have sidewalks in their neighborhoods? Do they have lit sidewalks in their neighborhoods? Is it safe? Are they surrounded by fast food and convenience stores? Or is it farmers markets and grocery stores and access to fresh fruits and vegetables? So it's really looking at those built environments and making sure that they have access to those things that keep people healthy.
And so what does some of the research say, about what are the causes of childhood obesity? What are the best ways to prevent it and address it?
Yeah, well, it goes back to the social determinants of health. So the social determinants of health are really the non-medical factors that are in our built environments. We know that those create impact and change when we address those both on a policy level and within our community with our partners. So it's making sure that they have access. Do they have a primary care doctor that they're visiting regularly? How can we make sure that folks understand the importance of that it's not just about making those healthy choices and choosing an apple over chips, but really, do they have the option of the apple in their community? Do they have walkable, safe communities where they can be active?